basically we say, how is blood produced in the body? Food has to go down into the stomach. The stomach then, what do they say, turns the food to soup. It prepares the food. The food moves to the small intestine. The small intestine is kind of like a colander, a strainer, and it drains the fluids out, which go to the bladder or kidney, depending on the tradition you study. So we have food into the stomach, then small intestine extracts the fluids. The fluid goes to the kidney and bladder. The urine is separated out. The pure fluids now go up to the spleen. The spleen converts the pure fluids into blood, so they're now blood. The blood then has to pass the lungs. The lungs put chi into that blood, and the blood becomes bright red. I'm sure you notice the difference between arterial blood and venous blood. The blood passes the lungs, and the lungs put chi in, and it gets bright red. What the heck does that? Can't be anything but the blood gets oxygenated. That oxygenated blood reaches the heart. The heart keeps some as nourishment for the Shen. It disperses the rest out, which goes up to the head. That's why heart chi deficiency, you have postural hypotension. I mentioned that a little earlier today. The heart chi can't lift that blood up and disperse it out. You stand up, you get dizzy. It goes up and nourishes the eyes. We often say that the circulation deep in the eye, heart, that's why you have macular degeneration. You have to treat the heart, and you use formulas like shui fu zhu yu tang, which relieve blood stagnation in the heart, opens up the blood vessels in the eyes too. And then that blood that's dispersed out by the heart goes into circulation through the body, and the excess is stored in the liver. The liver takes some of that stored blood and puts some in the uterus, in the case of a woman, and that makes for fertility. It also, that blood going to the uterus makes for sexual lubrication. And then some of that blood going to the liver supports the Wei Qi, remember? Process. So this is now kind of the blood production sequence. And so when we encounter a person and we make the diagnosis of blood deficiency, like they look older than they really are. My teacher said, that's the big sign of blood deficiency in a person. And it's not necessarily that he means they're wrinkly. Sometimes it's just their countenance. You say, I look at this person and they look old, even though I can see what their age really is. Still that's the blood produces. So you want to stay youthful looking. Somebody said, oh, it would be interesting to have a seminar on facial rejuvenation. A big part of that is making sure the person doesn't lose blood. It doesn't stay more youthful. So you see that patient. See, this person's blood deficient. I then look at this and say, where for them is the interruption? Could it be at this very first stage? Maybe the stomach has food retention. Then the best blood tonic for you is Bahawan or something that clears your food retention, because now you can receive the foods. Maybe you have heat in the small intestine. Heart fire is descending to the small intestine. Best blood tonic for you is actually all that stuff like Jurza and things that clear that heart fire descending. I'm not giving you Dongui and Shu Di Huang, that's not what you need. The reason you're not making blood is because small intestine can't receive the fluid. How about this? The fluid goes from the small intestine over to the bladder and kidney. How does it get there? Chinese medicine said there's a tube. It goes from the small intestine to the kidney and bladder. It's part of the triple warmer. And that tube is controlled by the mu point of the small intestine, Ren 4. And that really works. What if this person has loss of fluids through the stool and is blood deficient? Ren 4 is helpful for them. It actually helps the body draw the fluids in. But guess what? There's actually no tube there. It's like this imaginary tube that we're opening with Ren 4 really works to get the fluids absorbed. Of course, it's actually going through the blood circulation. So then, so the person with loose stools blood deficiency often needs some work around the small intestine to help the fluids absorb. The fluids go over to the kidney and bladder. Problems here, often the person is losing all the fluids as urine. Person with blood deficiency, frequent urination. They actually have cold kidney. Right? We tonify the kidney on, they start to make blood. Then, that fluid, maybe that's all working well. The fluid has gotten all through this, everything's working well. The fluid that is retained by the kidney, we call the pure fluid. Retained by the kidney, spleen to make blood. This pure fluid needs to become thick. How does the pure fluid become thick? It interacts with the yin of the body that's already there. And what nourishes this yin of the blood? Your points for kidney yin, like kidney 3, 6, or 10. Gallbladder 39, the influential point of marrow. All of these are said to thicken the blood. And the herb, Shen Disorders, we call that herb, it provides the yin of the blood. If you don't have this thickening effect taking place, the blood remains too. You actually see that in the diagnosis in menstrual disorders, where the woman, her menstruation is very light colored. Say, oh, the blood never got thickened. Give her yin tonics and strengthen the kidney yin. I find it interesting too. There actually has been a study showing that regular needling on gallbladder 39 increases clotting factors in the blood. That sounds like thickening a little bit. So then the pure fluids, if they're thick enough, go up to the spleen, and the spleen makes the transformation of those fluids in the blood. Hence the saying that really the organ that produces blood in the body, I mean, a lot of other organs have been involved already, but the spleen is the place where that conversion occurs. And it's the spleen qi that's involved there. That's where we get dang wei bu shui tang. We have all that huang qi activating the spleen to create the conversion of fluids into blood. Then the blood passes the lungs. You know where this lung qi enters the blood? At bladder 17, the level of the diaphragm. That's why bladder 17 is the influential point for blood. It's where qi, and it's why bladder 17 is both blood building and blood moving. Because it's like putting qi into the blood, and the blood becomes very active. My teacher used to call bladder 17 because like the herb dang wei, which builds and moves blood, bladder 17 does the same thing. And so we often call dang wei the qi of the blood. Shu di huang is the yin of the blood, and dang wei is the qi of the blood. And then finally, this blood reaching the heart. Some classical texts say the heart actually produces the blood, and the meaning for that is the process of blood production is now finished. And the actual statement in the classics is the heart puts its seal on it's like a name stamp on the blood. And that means that the blood is now accepted by it's actually a kind of a funny literary. When the emperor would accept a piece of art, he would put his seal on it. And so that's the heart, the emperor accepting the blood to nourish the Shen. He's put his seal. When we say the heart makes the blood, it's really that final acceptance of blood to nourish the Shen. By the way, you can actually see very famous works of art that have a seal right in the center. That's the emperor's seal. He said, oh, I accept, I'm the emperor. My stamp improves, right in the middle. You could do things like that as the emperor, I guess. So hopefully you make more blood than you need, and it goes to the liver so that you can have nourishment, lubrication, support of the wei qi. Of course, the liver does its own little jobs with this, like nourish the tendons, like benefit the eyes. But if you stay up late, if you overwork, if you, worst thing of all, stay up late, get drunk, and have an orgasm, then there's no blood. It's just, isn't it awful? You know, who would do that? I don't know. But they mention the possibility that somebody might think that's a good thing. That is the triple whammy for the liver. Well, in fact, what are they saying? They're saying that the liver needs to store blood during it. So staying up late, you're up during liver time, and it doesn't get the blood that would normally go there when you rest. So staying up late always taxes the liver. I don't care how long you do it, how adjusted you become to it. Somebody who does night shift work, for example, will always benefit from liver blood tonics. It just, because you can't change the human biorhythm in one lifetime. It takes 7. Chinese medicine says our bodies get programmed with 7 generations of behavior. Therefore, we are actually carrying the jing of 7 past generations. Hence the Confucian tradition that you should always know where the graves of your ancestors lie 7 generations back, because you're still carrying impulse from them. Tending the graves of 7 generations of past ancestors is really powerful feng shui to really engender your life. Nobody's doing that, but the concept is there. But the important thing for us is we can't, just because, you know, we've been doing it for a few years, working a night shift, doesn't mean our body's fully adapted to it. Sure, we feel better than we did originally, but still, liver blood tonics are good for that person. So, staying up late prevents the blood from entering the liver. Alcohol disperses the liver. So you can often see which people become like irritable drunks and stuff. They must have some liver stagnation with heat, and if you disperse that liver blood, that's when the heat really flares up and they become a really aggressive kind of drunk, you know, versus other people become sort of sweet and sloppy and stuff. They must not have that constrained liver heat there. So the alcohol is dispersed. And then orgasm depends on the liver. And the whole process of orgasm, if the liver is blocked or stagnant, you can't orgasm and such. So here you're pushing things out of the already deficient liver because you're up late and you're drunk. Then you have the orgasm, then the liver is kaput. So if you want to do that, stay up late, get drunk, and have orgasms, you better take a lot of liver blood tonics. You'll be able to do it more often. Okay, so that's the whole sequence of blood production. So in our postpartum depression thing, it says, you know, use the Chong Mai, spleen 4, then use spleen 10 and see your blood point, and then bladder 17. But we could actually be more specific for a particular patient and look if there's an obstruction to this process somewhere. This path right here that we described, coming from the kidney up through the spleen to the heart and on up to the head, is the Chong Mai. So this pathway of blood production is the Chong Mai, the sea of blood going right up through. Now we went through insomnia, depression. I put one more thing in your packet just because it sort of felt technically a mental disorder. You could see again and again sort of this overlap of how we're going to approach. Insomnia, we had to make sure that things descended. In depression, we had to make sure things go up. Here, hypertension is again a descending path. And we do have step 2, draining things down through the dumai and through the neck area. We had in the depression, softening the liver. Again, we see that step. So there's so much overlap in this. But let's just look at this. Again, this is a little digression from our mental disorders. But let's say you get the patient with essential hypertension, and you want to get that blood pressure down. It's scary high right now, and you want to get it down, or you want to get them to be able to reduce their blood pressure meds. You have to decide how you're going to interact with a particular patient about adjustment of medication. It's actually not in our scope to adjust their meds, right? We're not allowed to tell them, but that's not our prescription. Would we like it if they went to their regular MD and he started to adjust our herb prescription? We wouldn't. They said, what does he know about herbs? In fact, they often say stupid things about herbs. You know, they read one little article and then all herbs are good or bad or what. You know, they have no idea. We wouldn't expect them to. So similarly, we have to be thoughtful about how we're going to adjust medication. I think the best way, in a perfect world, is to dialogue with their physician. You call him. We got a patient in common. They want to reduce their meds. How can we go about that? Are you supportive? Here's what I'm doing, and I expect that that's going to help control the situation. They may not need. And if you have the right doc on the phone, he's going to be willing to participate in that. If you have the wrong doc, he won't talk to you. He's not interested. He thinks you're crazy. He thinks, no, there's no other way. Then what? Then you have to address it with the patient. I tell them straight up, look, I can't adjust your med. That's not my role. But, here's how you would do it if you would do it week by week or whatever, or keep track of your blood pressure, and we're going to see how it's progressing. And then it's up to them to make the choice. You know, maybe you actually have a better doctor to refer them to, somebody who's open to what we're doing and will be participatory in, because a lot of docs, like in this area of blood pressure, they're like, once you're on it, you're going to stay on it. It's only good for you. You should just keep on those antihypertensives. A lot of patients don't want to do that. And of course, we know that it has its downside. So, yes?
There's really one blood pressure medication that old patients really should not mess with if they're on, and that's clonidine. If they start messing with it, on hypertension and have a stroke.
Sure.
That's the worst.
Yeah.
So of all the blood pressure medicines, that's the one you have to be very good.
That's good advice, right? And so there's where the issues come in. How if you're going to involve yourself in them titrating down on their meds, you got to look at which ones they're on, clearly know about that, and what the normal way of withdrawal is from that. You know, so.
What'd she say?
She said. Clonidine is you can get as you go off it, you can get a rebound of hypertension, and so it can spike up really high.
And you'll stroke out.
Mm-hmm.
Yeah. Happened to me.
Do you had it?
No, I'm Western trained, and I had a patient who stopped and not stopped.
Yeah, and that's often the issue. And as I said earlier, it's particularly of relevance in our mental disorder thing, because a lot of meds, you really have to titrate down gradually, you know. And in this area of hypertension, of course, you want to have the person monitoring their blood pressure very regularly to see what impact, because there's also the additive effects. If you're going to start putting your treatment on top of their blood pressure meds, they can have an additive effect, and they start to actually get hypotension. And they're starting to get all these blood pressure drops as a result. So you want to, you know, it's a tricky business to start to wean the person off of their meds. So we have to be thoughtful about it. But an easier case. This person comes to us, the blood pressure's climbing up, you know, they've got a diastolic pressure of 110 or something. It's way too high, but not like scary high. You know, it's like they've resisted starting their blood pressure. That's easy to start to deal with. So the first thing you do is take their blood pressure, see where it's at right then, go ahead and do some points like this, combination of points. This is really draining the yang ming, but you're on the upper part of the yang ming, the large intestine meridian. You're using the lung 7 to connect with the Li4. This brings yin into the meridian, and the effect of this is to drop yang from the head. And you is doing this. Does the diastolic pressure start to drop? Systolic pressure is not useful here, because just having them lay down with some needles for a while drops the systolic pressure. Everybody relaxes, the systolic pressure goes down. But the bottom number, if that's dropping, that residual pressure, if it drops from this, it's going to be a really easy job. You know, just this kind of draining yang from the head starts to drop the diastolic pressure. Oh, that's often it doesn't come down much. It's still a helpful thing to do, but then we go to the second phase where we open the vessels around the neck, you know, so the yang can descend. We have the do 16, do 14, the drain yang out of the do. And we usually start to see the blood pressure move. I like to see about a 10-point change in the diastolic pressure. Step 3 is optional. If neither of step 1 or step 2 change the pressure, then we use stomach 9. Another sort of window of the sky point. this one actually invokes the carotid reflex. So typically we'll bring the blood pressure down, at least temporarily. Now, my old Korean teacher used to be quite aggressive on this point. In fact, he didn't needle stomach 9 at all. He actually attempted to touch against the carotid artery. He would touch the carotid artery with the needle. There's no harm in that, except you can give a bad bruise to the person. And if this is an older person with lots of plaque in their arteries, they can actually pass out from it. You can get a good effect just needling stomach 9 without being so aggressive as to touch the carotid artery. So that's what I put here. But be aware, there is that technique in Chinese medicine of actually touching the artery there, and you get a reflex that really can drop the blood pressure in a hurry. So this is all about draining yang down. Then, the second step, really the second thing that we're shooting for, is to relax the abdomen, blockage in the yang ming, just like in our insomnia discussion, where we have actual congestion in the abdomen, we need to open that space up. Now this first group of points is kind of interesting. This is when there is blockage in the abdomen due to stress. The person is holding stress in their stomach. Stomach 24 is quite important for that. And same, by the way, even people who have things like irritable bowel syndrome and the like, if you use these points, stomach 24, 25, 27, you actually release that emotional constraint in the stomach and intestines. Somebody told me why stomach 24 in a lecture, because I never knew that, but some classical reference about this point having a particular effect on emotions. Now, if they actually have constipation, and a lot of your hypertensive patients will be constipated, then we have this group of points, which is more opening the intestine. This third group of points is very kind of, regulates digestion, gets rid of food retention, that kind of much milder stomach regulating group. So we relax the abdomen, really draining the yang ming, and then we soften the liver, just like we did in the depression. And there you see liver 3 and liver 14 for your general liver qi stagnation. You could borrow any of those other things from the other page where we talked about softening the liver. By the way, electric stim from liver 3 to liver 14 helps cholesterol levels in the body. That's something I made up. I have actually been surprised that works, but in fact, somebody suggested it to me at one point, and I started trying it, and darn it didn't help. I usually use herbs like danshen and maldongxing. Those herbs have a strong cholesterol lowering effect, and then I run electric stim between liver 3 and liver 14, and that can be a good cholesterol regulator. I think it actually stimulates the liver to either help excrete cholesterol, bile, or to actually produce less cholesterol.
Do you have a formula you want for hypertension?
Well, again, you have to think about is it something about, I have to drain yang downward? And if that's the case, what kind? Is it empty heat? Is it full heat? Am I going to use something like Langdan Shegan Tang to drain true fire? Or am I going to use something like Zhibai Di Huang Wan to drain empty heat? So choose something like that. If you think, this is the stage I have to, if instead it's more like this abdominal stuff, then all of your Chengqi tongs with Da Huang in it, really good for dropping the blood pressure. Or if it's softened the liver, then it's your liver qi clearing, like Jiao Wei Sha Yao San. So think about where in this process you see this patient's major issue and target your herb formula at that spot.
Alex, when you do e-stim, do you have a preference as to where you do your black and red leads, like the direction?
I don't. Again, as I said earlier, I do e-stim in such a simplistic way. My e-stim is always low frequency. If possible, I don't like to go too large of a distance. Now, admittedly, in this case, liver 3, liver 14 is a pretty big distance, but most of the time, I tend to connect my e-stims in fairly local areas just to get stimulation on those particular points. And so I don't work using the E-stim, trying to drive the chi in one direction or the other or something like that. You know, the one time I would say I think about that, sometimes I'll do things like, what about a person with chronic sinusitis? Really often in that, they actually have retained pathogens in the sinuses. And so I love to do electric stim on that and try to actually cause that to open that blocked area where the pathogen is constrained. And so I go large intestine 4 to the place on their face where I think the retained pathogen. I just press all over the sinuses and look for sensitivity, maybe not necessarily painful or funny, or actually opens it. I put the needle there, go to LI4, run the electric stim. And a lot of times when you do that, they feel all the electric stim at LI4. And switching the lead sometimes gets the stim up there on the face where I want it. So, you know, it will sometimes vary like that. You can do that on kids too. Really helpful for kids with chronic sinus stuff. In that case, I don't put a needle in, I just put the electric stim cutaneously on that point. But I press all around their face and look for where the kid reacts to my pressure. Even tiny, tiny kids, as you press, they'll kind of flinch or guard a certain spot. That's where you need to focus at. And then often green snot comes out right away or some really impacted area. Even people on antibiotics for sinus infections, often it's not working. You stimulate like that with the electric stim, and suddenly the infection starts to clear. I think what you've done is you've enabled the antibiotics, the body to deliver more blood to that area. That focalized infection gets vulnerable somehow when you stimulate that. So anyway, so think of it like that. If you need to switch them around. Okay, if the blood pressure is not coming down over time, you have two choices. One is there's heat and stagnation holding the blood pressure. If that's your suspicion, use points like pericardium 9 and the apex of the ear. You can prick these points, bleed out some blood, and it clears that. And so in that case, I would use very refrigerating herbs like gypsum, and I would maybe think about adding blood stagnation treatment to really get things freed up. Or the other option is they really have kidney deficiency, especially your hypertension in the elderly will actually be kidney deficiency hypertension. And in that case, you're not going to get it by bleeding. You're going to get it by warming. So you burn moxa on DO4. I tell you, you get an old fella with heart disease, maybe he has angina and the like, you know, a little bit of exertion, he's already sweating, you know, and he has that red blood vessels in his face and his nose, you know, and he comes in and, you know, he's kind of getting up on the treatment table and you're afraid, oh my God, he's going to die before he leaves the clinic, you know. And I hate it when the EMTs have to come in and take a patient out, you know, right? So you see that kind of guy, and he lays down, and you're going to take his pulse, and you go, oh, but his pulse is pretty good. Ain't likely. His pulse is flooding. It's deceptive. It's showing you the yin deficiency with empty heat going on. That kind of presentation, you put moxa on DO4. His pulse disappears. You think, I killed it. No, you didn't. You actually, now his pulse is showing his true deficiency underneath. You've regathered the yang back down to the kidney. In fact, very interesting herbal formula for that is to combine Huang Lian, very cold, that enters the heart, with rogui, cinnamon. And that directs the heat down and back into the kidney. We have other points that do that too. Kidney 2. Kidney 2 with moxa even will gather that empty yang back down. Yeah?
From the Shan Hanling's description of the deficiency when intake, should this patient possibly be experiencing that as well?
Yeah, that's what they kind of up when they say he's got that flushing up and he feels that agitation and it's, you know, he's sweating with a little exertion and maybe he has that pain in the chest. It is all that flushing up and there's that deficiency below and you can pull it back down. You know, it's interesting how DO4 has that effect yes, it's Ming Men tonic, and it's warming to the yang, but it gathers the yang back to the where it belongs. You know, so for example, that funny thing that some people talk about, they get Kundalini headache. Like they meditate somehow, they're doing all this like eye concentration, they're doing some kind of, and they get a headache, really bad headache, like triggers a migraine, like the Moxa on Do 4 really helps that. Brings down that rising yang that they've created from their, I had an interesting patient a while back. He was a guy doing a lot of Qigong. He did this funny Qigong where he would try to keep breathing in without breathing out. Very natural practice, isn't that? That sounds balanced to me, right? But basically what it is he would breathe in, and then he would do a movement to project the Qi into one extremity, into another, to drive the Qi down into each leg, each time sniffing in, and he would, he'd get bright red and stuff, and I mean, it's like, it's the kind of thing that's disturbing to even watch him do, but this is a Qigong method, about gathering all this Qi into the body, and as a result, he had headaches, he had tight neck, he had sleep disturbance, Well, Moxa on Do 4 was really helpful for him, And I encourage him to develop another style. Please breathe out sometime.
What about like Moxa on Do 4? What about like menopausal women who are having like hot flashes?
Exactly like I mentioned yesterday, when they have the weakness below and the heat rising above.
Okay.
Yeah. So they'll typically have feet are colder to the touch. They'll often have tiredness of the legs. Especially this is common in women who have hysterectomies. Because that in itself is very weakening to the lower part. And so they get all that yin deficiency heat flushing, but they've been weakened by the... I actually had a patient not long ago who had... they didn't have a hysterectomy, but they had cystocele surgery. And they started to get hot flashes, and they felt very fatigued in the legs, and that kind of thing was very helpful for them. In that case, I also did Moxa on Ren 4, building the Dantian area, but it's the right theory to gather that yang back down. So we have those two choices, really kind of bleeding out or kind of gathering back, and put that person on kidney tonic formula. This is a great application of something like Jingwei Shenqi Wan, your 8-flavor Ramania kind of approach to really build kidney yin and yang will gather that back to the kidney. Then we have to decide about the Zhang Fu sort of aspect. Is there the yang rising? We can drain the heat in the liver. Is there kind of more yin deficiency or kidney deficiency? We have the kidney. But now your question about, what about all that phlegm, damp, fluid? So you see the third choice is if the person has obstruction to normal fluid regulation, this pushes the blood pressure up. Then we have this opening the water channel and clearing phlegm damp combination of points. Spleen 6, spleen 9, spleen 5, all of these are very drying. So before you could add to this prescription kidney 7 if you wanted.
This is the swelling and falling that you go.
Right. So then, do you want to use Zhuling Tang because they're more yin deficient? Very typical in this. In fact, that's quite good for the hypertensive patient. Zhuling Tang has the huash, slippery and downward action. Could be Wuling San. Wuling San is always a safe diuretic, even though in theory it's a little bit yang invigorating. How is it yang invigorating? By Guizhi. And so the Guizhi directs heat where it belongs anyway. So Wuling San is always a safe choice, even just... I tell you, many practitioners say Wuling San is actually, when there's urinary output issues, it's always a safe and good choice for kidney regulation. And I've certainly seen that clinically. People with decreased urinary output due to drug reactions and the like, you can always be fairly casual in prescription of Wuling San. Now, during pregnancy, you may actually have to add more chi tonics to it, more spleen chi tonics, but still the Wuling San is applicable if you want to move the fluids around. It's not going to overly diurese the person. Lots of tricky ways to use Wuling San. Like kids who are, I never did it with an adult because I never had an adult patient who looked like this, but kids who can't even hold down fluids, they're vomiting and the parents are worried they're going to dehydrate now because they can't even hold down the fluid. You can give them a little bit of Wuling San, and it actually enables them to start to hold the fluids down when they drink it. It disperses the fluids quickly out of the stomach, and so it makes the stomach fluid intake. So maybe you're trying to give the kid electrolyte replacement drink or something, and so you give them first a little spoon of Wuling San, and then they drink those electrolyte drinks, and it won't come right back out. Another tricky use for Wuling San is when you have fluid in the inner ear and you want to get it out in a hurry. You put the person on Wuling San. I often talk about this in pediatrics because you always get those cases where the parent brings their kid in. So my kid has had recurrent ear infections. They have fluid in their inner ear, and now the doc wants to put the ear tubes in. But I thought before we do that, maybe we try something alternative. I said, okay, we can often put the ear tubes in. Oh, next week. It's like, so I have 1 week to get that fluid out of the inner ear, which they've been having recurrent ear infections for the past 3 years, and now, put them on Wuling San right away. Often they will start to get increased move because basically you just use they're just using air pressure to check the movement of the eardrum, and you take Wuling San for a week, you'll often see increased movement of the eardrum. So then he'll say, okay, well I guess we can wait a little while to see if that's going to work. So Wuling San's a funny formula. It has a lot of broad application like that. Again, based on Guizhitang, our first formula under heaven. Now anyway, after we've worked with these steps and chosen where we want to target, and finally the blood pressure is down into an acceptable range, we should start regular moxa on spleen 6. Regular moxa on spleen 6 tends to help stabilize the blood pressure where you want it to be. And you can teach the person to do that at home. However, regular moxa on spleen 6 may increase fertility, so we should warn them about that. If it's a person who is in an age and a circumstance where that might be a concern. In fact, as a very simple homework for increasing fertility, both men and women could do 6 for 1 week out of the month. Usually for women, if you suggest they do it right after their period. Now, intradermal needles, step 10. This is when you want to hold the blood pressure down between treatments. You see a drop during the treatment, and yet the person tells you, oh, but by tomorrow or the next day, my blood pressure's high again. I'm checking it at home, and it's too high. You can leave intradermal needles in back shoe points to help hold the blood pressure down. And the points I suggest are things like bladder 15, bladder 17, 18, 23. So you have heart, blood, liver, kidney. You could just put, I have found this to be very helpful in pregnant women whose blood pressure is creeping up a little bit. They can wear these intradermal needles between the treatments.
Sending a patient home with intradermal needles on their back, would you do this with a patient who is relatively alone?
Yeah, no problem. The worst that happens is they lose them. They never, nothing bad ever happens from this. I like the type of intradermal needles that are flat, shaped like that. I don't like the type that are like a little thumbtack, shaped somehow like that, I like this type. And the general way to insert them is you look at underlying muscle of where the point is. And the muscle fibers tend to run in a certain direction, like along the spine. The muscle fibers are running more up and down, right? All the paraspinal muscles, the fibers run that way. So you always put the intradermal needle in crossing the muscle fiber because that has the least amount of expansion and contraction of the skin. So the needle won't tend to work its way out. So on the back, you tend to put the needles in like this, not up and down like this. These will tend to work out more likely. And then you tape them over. I find if there's going to ever be any irritation from these things, it's more because the person reacts to the adhesive in the tape than it is the needle itself. High quality medical tape that's hypoallergenic, like 3M Micropore or one of those things. You tend to, same thing with those herbal bruise plasters and stuff. It's almost never the herbs they're reacting to, it's the adhesive in those things. And, if you pull a whole hunk of skin off, it's because the person has really reacted to the adhesive in there. So get a good quality medical tape, and to make the tape stay, clean the area first with alcohol to get all the skin oils off as much as possible. Don't touch the tape in the process of putting it on there. Use a forceps, take the tape, clip it up, and put it on without getting your greasy fingers stuck on there. And they tend to stay on well then, and so it's more a question of smooth technique than it is that people react to the dermal. Okay, so that's the hypertension there. But I just threw that one in there because it sort of looked so much like what we just talked about, insomnia, depression, hypertension. You can see it's just this step-by-step regulation of the chi in the body. Now let's go back to we were working our way through the packet. I think we're on page 17 maybe, huh? Oh, we had page 16. Let's hold on 16 for a minute. That's Yangsheng and our main topic today. So let's go. Page 17. We're doing okay. There's only 50 pages in the packet. We've gone through some of the other ones, so I'm doing it. Yesterday, I mentioned several times that issue of pathogens retained in the body. So I wanted to make sure to reinforce the procedure for eliminating those. Those of you who've done peds with me know this already, but we just even touched on it with the sinus thing. If you think there's a pathogen retained in the body, always try to treat the site where you think it's located. In the case of the sinus thing we just talked about, find that spot on the sinus. In the case of the ear, do points around the ear, wherever you think it is. It's usually in these, but we can see it at the base of the teeth, for example. I mean, insurance actuarials will tell you could give cheaper life insurance to people who floss their teeth. Why? Because lingering pathogens stay there and then can spread through the body, So if you think the person has a pathogen retained somewhere, treat that site, reach that spot. We have the unique ability with acupuncture to touch a lot of areas that otherwise aren't accessible, Same thing in orthopedics, right? I love that when they say, oh, this tissue, that tissue is a heal on its own. You just stick a needle in there, boy, you can get change going. Isn't that great? That's why I hate these approaches that say we never treat the symptomatic area. What nonsense, in my opinion. Like Richard always teaches a lot about that in orthopedics, right? Is not to he always likes this diagonal truth. So he and I were lecturing at the same conference in Germany last year, and I spoke right before him. And Richard got up and said, "Oh, Alex, I like to call him Mr. Local, because that's my shtick all the time. Is that I'm going to treat exactly the spot, So, I'm not saying that he's necessarily wrong, but it's my thought is that I really want to touch those affected areas. We have a great potential, I think, with acupuncture to do that. So you can, meniscus damage in the knee. I'm going to stick a needle in. I want to reach that place, so, and I see repair as a result of that. That's just my philosophy about it. And the same thing here with these retained pathogens. I want to go to that site if I can.
I was just going to say, I asked Dr. Ton once, why don't you put a needle right in the muscle tissue where it hurts? And he says, oh, so Andrew, you would smack a crying baby in the mouth. Shame on you.
Well, let's not go there. but you would, right?
I didn't say he was wrong.
So when we say treat the site of the retained pathogen and then attack the pathogen according to its nature. Is it hot? Is it cold? Is it damp? We can treat accordingly to that and try to help clear that pathogenic agent. Whether we do that with our local treatment by applying moxa, whether we add other points because they clear heat and toxin, something, same with our herbal approach. Do we use more dispersing cold, warm herbs? We're thinking about the nature of the pathogen. Then, third step, we can't ignore swollen lymph nodes. Those are actually blockages in the Shaoyang level. We could really think that the lymph is kind of that intermediary level a lot. And so when there's swollen lymph nodes, we can say there's phlegm nodules or retained pathogens in that intermediary layer, and we need to free that out of the body. So I like to directly treat the lymph nodes. If I see them there, I want to put needles in them. Where was I? Oh, I was in Baltimore 2 weeks ago doing a lecture, and somebody came up to me and said, "You were here last year and spoke and talked about needling lymph nodes." And she said, "I would have never done that before." And she said, "Right after that, I had several patients and I needled their lymph, and it was so great. I was so happy you taught that." It was kind of positive reinforcement to hear somebody actually does that, because it really is helpful. And there's really no downside to it.
You're needling right into them or around them?
Right into them. Stick the needle in the lymph node. Any place. Yeah, inguinal, axillary, whatever, doesn't matter. Now, it does beg a certain question. Some people say, what if these swollen lymph node is can we actually accelerate the metastasis of the cancer by stimulating the lymph node? All of my teachers have said no to me, and I have asked, because this question always comes up, and they say that is not their experience. And in China, the teachers I've talked to about this say they've actually tried to track that carefully, and that just doesn't seem to happen. If the cells are metastasizing through the lymph, the fact that you put a needle there doesn't seem to accelerate that process. That's what they say. I don't have enough basis to say for sure. How can I tell? I mean, the patients I'm typically treating. So I would say, if you want to err on the side of caution here, look at when did these lymph nodes become swollen? What were the circumstances? If that followed a clear external attack, the person was sick, had fever, the lymph nodes swelled and never went down, I think you're safe there. If this is a sudden appearance of lymph nodes with no obvious infectious component, okay, maybe we don't need to be aggressive and try to drain them. We need to do more diagnosis and see why they have. So maybe that's the time for referral. Let's see, what is this swollen lymph node issue? Certainly a person who has appearance of swollen lymph nodes with no preceding fever, with no preceding infection, I'm wondering about that, right? But like these inguinal lymph nodes often follow gynecological bladder infections, stuff like that. In that case, I'm not so concerned that I'm going to spread some kind of, cancerous metastasis that's happening. It's just, so, as I say, so this question does come up, but I will tell you, people with lingering pathogen problems, treating the lymph nodes is a big help to them. They really make progress from that stimulus.
What about cases with patients with herpes or HIV?
I think the same thing, especially with something like herpes, for sure. Now, when you're dealing with HIV, you want to think about if this person really significantly compromised immunity, where they're getting a lot of opportunistic infections. I don't like to be too aggressive with needling just because they don't have much defense from the very trauma of the needling. So it's, I guess in that case, if a person with a compromised immune system, I would tend to be more cautious, not be too aggressive.
Do you encounter patients with compromised immune systems who don't, in the pulse or other signs, indicate significant deficiency that should be tonified to prevent illness from staying?
So do I encounter patients who have compromised immunity but don't have that deficiency presentation? I don't think so. I think usually by the time the person has immune system compromised enough that they're getting these weird, I mean, you're actually taking me back some years, you know, because nowadays the HIV patients I'm seeing are so much better controlled. You know, if you're talking about, you know, 20 years ago, man, we were seeing the really sick people, you know, and you actually got to see a lot of that Julian death pattern, you know, in your clinical practice in a way we just don't encounter so much now. So back then, those patients always were coming in very deficient, you know. So yes, they would have the infections and there was that heat and pathogen, but they were very deficient. And now it's probably less like that, you know. Anyway, so think of this in your herbal prescription. By the way, when we think about the pathogen lingering, I'm quite convinced from my observation that people who take antibiotics have a higher tendency to have lingering pathogens. I'm not saying antibiotics are bad. Antibiotics just have an incomplete action sometimes. They clear heat, they suppress the acute infection, but they actually lower your body's own immune response. Many Western studies show this, that after taking antibodies, your own antibody production is reduced. Therefore, I like to combine, if a person's on antibiotics, I like to combine them with surface-releasing herbs. I think you get a more complete effect. So the first part of our pattern here herbally is to use surface releasers. Still, the surface relievers provide pathway for release of the pathogen. Then we use those herbs that clear phlegm nodules, Jingjie, for example, those kind of herbs, good for the swollen lymph node. With acupuncture, make sure you use points like the wind points. That's step 4, opening the surface. Special points for lingering or retained pathogens, which we already learned, ladder 43. Remember, shoulder jerks because the pathogens leave the chest. For the head and neck area, Bai Lao, extra point on the neck is especially good for retained pathogens. Classically, it was for chronic lymph swelling with tubercular infections and things, but for all kinds of pathogen problems. And then final step is, I should mention 2 more points, gallbladder 37 and 40. Those 2 points together are clear the Xiao Yan. They're kind of the Xiao Chai Hu Tang of points. And the final step here is to treat the underlying Zang that person is presenting, such as Wei Qi deficiency, kidney yin deficiency, whatever it is, liver blood deficiency, that has seemed to make them vulnerable to this pathogen. So that's the procedure for eliminating retained pathogens in the body. Yesterday we mentioned memory, and I said we'd eventually talk about the different kinds of memory. Well, here it finally appears in our packet. Let's do that, and then we'll take a little break. There's actually 2 types of memory, explicit and implicit, as it's called. Explicit memory concerns both facts and past events. Implicit memory is things like being able to do tasks and sort of has a body memory aspect to it. You know, things like riding a bicycle has a certain implicit memory aspect to it. So usually when we talk about memory loss, we're mostly focusing on explicit memory. And explicit memory has both facts and past events. The facts part depends on the E and therefore requires spleen tonification. When you can't remember specific facts. When you start to lose memory of past events, that has 2 aspects. There's the short-term memory, relates to the heart, and the long-term memory relates to the kidney. So what happens as a person starts to have they first start to lose short-term memory. So they can remember all about things that happened in the past. They remember people who they've known a long time, but new acquaintances, recent events, what they went into the room to get, they forget. That's all heart-related memory. As that memory loss, and now how does this work? Short-term memory and long-term memory work together, because in order to move things into long-term memory, we rehearse it back through short-term memory. That's how we practice to memorize something. If the heart is disturbed in some way, the Shen is disturbed, loop back and forth, the memories become inaccurate. In fact, the more you rehearse memories through a Shen disturbed mind, the more inaccurate the memory becomes. This is actually the problem very often with eyewitness testimonies and the like. People will swear, I remember it this way, and the more they think about it, the more it becomes very clear to them, but it could be totally inaccurate, because in the process of cycling it through short-term back to long-term, they're rehearsing it in an inaccurate way. And it seems more and more clear, more and more my memory is better about this now, I've been thinking about it. There's many studies now that show this, that most accurate long-term memories are the ones that you haven't ruminated on very much, because you haven't had a chance to distort them. So we see this process very commonly in patients with dementias. They start to talk about events that their families there and say, it didn't happen like that at all. And yet that person is so, I remember very clearly my brothers and sisters, this and that. They're telling you these whole stories about the past, and they're totally convinced. What's happened is they've been rehearsing their memory through a disturbed Shen. And so they've reinforced this memory in a... So basically this sums it. We say that we have the three kinds of memory: spleen, heart, and kidney. Spleen memory is memory of facts. That tends to take a long time to go away for the dementia patient. They often can remember how to do things, like they take care of things in the house and stuff. At some point this starts to go too, right? They start to do those weird things like put their laundry in the oven. Almost right, but not quite, But when they can't, at first they start forgetting, they told you something, they tell you the same story over and over again. That's the short-term memory thing. And then they start to eventually can't remember who their family members are. That's the kidney memory. So spleen memory, heart memory. You can, from the type of memory loss, you know where to. Implicit memory loss does involve the Shen some, but involves the Po. So if you stop losing the ability to do rote tasks, then you better treat the lung. I mean, maybe sometimes just the clouding of the Shen makes them report the things in a distorted way or something. But really, my understanding of it is, once you've rehearsed the memory in a distorted way, you just think that's the way it is. So I don't know what the mechanism for that repair would be.
You wrote fast, like remembering like kids with baby difficulty?
Like doing things like you'll often see a person with fairly advanced senility can still do things like cook something or something like that. Now if it's an involved recipe, they can't follow that anymore. But just to do the simple, they can fry eggs and things like that. It's to them a rote task. It's not something that requires this kind of memory process of the steps and all. And it's interesting how memory can be has a lot of anchors. For example, if people have visual triggers, they can often jog their memory. They often say this is stimulating the Shen through the eyes. So for example, people who start to forget members, if they regularly review pictures of their family members with the name is written on them and stuff, it can help anchor that memory for a lot longer. I can think of one of my patients with Alzheimer's who she's fairly early stage. She still lives with her husband and he's older, and their kids, you know, are in the community, but the kids, they have pictures by the phone. And they actually call and say, this is, and as long as, when she looks at the picture, she remembers who it is. But if she answers the phone and they tell her the name, she has no idea who she's talking to. But the visual anchor helps her. And this is said to really kind of refresh the Shen, you know. You could
remember like the name of something, or somebody's name, is that like a spleen thing? Then you're saying this person, but I don't remember his name.
Yeah.
Yeah. Or a word you can't recall.
No, you know, that kind of thing where you just can't come up with the word, or you just, that's probably more heart, not really spleen. Spleen really is concerned with organizing data somehow. And so, by the way, spleen also is very involved in your reading skill. If we have a kid with a learning to read, tonifying the spleen usually helps that. If they're delayed in their, whereas math skills tend to be much more liver. That's interesting. Regulating liver qi helps kids who struggle with math. Some sense to me that we see more boys with problems of math skills and more girls, vice versa. Girls are good readers, boys are good math, because we say that female is more spleen and male is more liver. Remember, the spleen is your mother and the liver is your father. Some speculate that when, as an adult, you adopt behaviors that injure one of those organs, you may be reacting to your parents. People who do destructive behavior to their liver may be rejecting their father's influence.
Where did you get this?
Oh, my teacher used to talk a lot about this, say that your mother affects your spleen. So what he would, and remember, my teacher was a very traditional Korean man. Family was organized in a certain way. The parents' job was to nurture the children generally. The grandparents' job was to discipline the children. That ain't nothing like modern times as far as I know. You know, now the grandparents' job are to spoil the kids. The parents' job is to be busy somewhere else. So that's, you know, it's like that, right? He would say, this is exactly the 5-phase relationships. Grandparent controls, you know, and parent nourishes, and that's exactly the family. And I'm saying, I didn't know family I see now, but you know, he would say so. And so he was very traditional. He'd say, your mother has impacted your spleen. If you didn't get enough care from your mother, you have spleen qi deficiency, and if you get overly mothered, you get dampness. Over-mothering is your mother doesn't let you make any choices for yourself. She takes care of everything. Her decision is always, you know, what's right for you. And so you end up with damp. So your mother's being spleen. Of course, is that true nowadays where the mother is not doing all the traditional dad, your caregivers, the dad, and everything? Probably. And then the fathering influence, they say the father represents the discipline. If you are under-disciplined by your father, you get liver qi stagnation. And if you're over-disciplined by your father, you get liver fire. Again, we can't say it's always the father now, right? But the rule's still useful. You'll see kids who come from too disciplined an environment. And as a result, they act out in a very fiery way. They rebel against that. On the other hand, my practice, I see lack of this in there. And they end up with liver qi stagnation. If a kid doesn't have clear boundaries and have consistent kind of discipline, where I see this problem a lot, kids these days that go back and forth between divorced parents. Often the discipline is radically different from household to household. Those kids always get liver qi stagnation as a result. And if the parents could somehow, but it's a lot to ask, there's a reason they're not living together anymore, right? So if they could somehow come to some consistency with the way they deal with the kids, it's much easier for the child to have clear qi regulation. So that's how we could think. So then the is that all of that discipline influence is coming in through your liver. That's your father. Nowadays, maybe it doesn't apply that you're rejecting your father because you're rejecting the authority figures in your life when you damage your liver. And the spleen, you're rejecting the nurturing figures in your life. Maybe we could say it like that.
But if you're also go by that thing, treat if the parents, say the mother comes, or say the mother comes in with the child in this divorce situation where they're going back and forth,
Yeah.
you can't affect the individuals themselves, or you can't affect the households and get the parents to get together. You can still do what you were discussing. You know, work with Chinese medicine on the person that you have in your office, and you can say
Exactly. Her point is so important. You're treating the child to be able to tolerate the circumstance that they're in. They're in a circumstance, but I think it's interesting for us to see that we can actually interpret for a particular kid what is the correct level of discipline. If we see liver fire, we know they may have an overly structured circumstance or a lot of pressure of discipline. So if we see liver cheese, they're not getting enough. We don't need to know what the right level is. We have to find the level that matches that kid, and we see their reaction to what's happening. So we could, if there's an opening for that, you know. But as you say, a lot of times there's not an opening. After all, people are people that they learn to parent from their parents who may not have done a good job either, and so we can't always expect them to be perfect in the way they interact with the kid. We can help the kid tolerate that and still regulate in the face of that circumstance. I think we do that a lot with hyperactive kids. I'm sure we do, because a lot of teachers are stressed out. Class is too big, workload is too high, they have their own life issues. They can't be perfect. And so the way they interact with their students may be difficult for a particular child. You can treat the kid and suddenly, okay. It doesn't have, I don't have to flare up in heat from that and become hyperactive. Okay, shall we take a break for